Welcome back to our channel. Today, we're diving deep into a critical health topic that affects millions of people worldwide: chronic kidney disease, or CKD. We'll explore the latest advances in its treatment and management, and we'll break down the stages of CKD to help you understand this condition better. Whether you're a patient, a caregiver, or just curious about kidney health, this video is packed with valuable information. So, let's get started. Persistent kidney sickness is a dynamic condition portrayed by the slow loss of kidney capability over the long run. A serious medical problem can prompt kidney disappointment on the off chance that not oversaw as expected. Yet, fortunately, there have been critical advances in the recognition, treatment, and the executives of CKD. We should initially discuss these headways. Early recognition of CKD is essential, since it takes into account opportune intercession, which can slow the movement of the infection. Here are probably the most recent advances in early identification and analysis. Biomarkers. Conventional markers like creatinine have been utilized to recognize kidney capability. Nonetheless, fresher biomarkers like cystatin C and NAGLI, neutrophil gelatinase-related lipocolin, are ending up more delicate and solid. These biomarkers can recognize kidney harm at prior stages, considering prior mediation. Hereditary testing. With progressions in hereditary examination, we can now distinguish hereditary inclinations to CKD. This aids in anticipating the gamble of creating CKD and considers customized treatment plans custom-made to a person's hereditary cosmetics. By using these high-level demonstrative devices, medical services suppliers can get CKD in its beginning phases, allowing patients a superior opportunity at dealing with the illness successfully. When CKD is recognized, the subsequent stage is treatment. There have been a few energizing improvements around here, particularly with new meds and treatments. Pharmacological advances. SGLT2 inhibitors. These medications, for example, dapagliflozin and empagliflozin, were at first produced for diabetes. Notwithstanding, they have shown huge advantages in easing back the movement of CKD by lessening pulse and proteinuria. Non-steroidal mineralocorticoid receptor bad guys, MRA-Z-finerenone, is an illustration of this new class of medications that lessens albuminuria and eases back CKD movement without the secondary effects related with steroidal MRAs. Mitigating specialists. Irritation assumes a basic part in CKD movement. New medications focusing on aggravation, for example, canakinumab, are being scrutinized for their capability to dial back the infection. Regenerative medication. Undifferentiated organism treatment. Exploration is continuous into utilizing immature microorganisms to fix and recover harmed kidney tissue. While still in the trial stages, early outcomes are promising and could upset CKD treatment later on. Tissue designing. Advances in bioengineering are prompting the improvement of fake kidneys and kidney tissues for transplantation. This could give a renewed perspective for patients with end-stage renal infection, ESRD. Innovation is assuming a huge part in improving the personal satisfaction for CKD patients. We should check out a portion of the mechanical headways. 1. Wearable dialysis gadgets. Conventional dialysis can be bulky and tedious. Developments in wearable dialysis innovation are making it feasible for patients to get treatment in a hurry, working on their personal satisfaction and decreasing the wait of dialysis meetings. 2. Telemedicine. The coronavirus pandemic sped up the reception of telemedicine, and this has been especially useful for CKD patients. Remote observing and telehealth administrations consider normal checkups and opportune mediations without the requirement for regular medical clinic visits. These innovative headways are making it simpler for patients to deal with their condition and remain associated with their medical services suppliers. Notwithstanding clinical and mechanical advances, way of life and dietary changes assume a vital part in overseeing CKD. We should investigate a portion of these mediations. 1. Customized nourishment. Advances in wholesome science have prompted customized dietary proposals that can assist with easing back CKD movement. An eating regimen low in sodium, potassium, and phosphorus, joined with sufficient protein consumption, can have a tremendous effect. 2. Practice projects, custom-made practice regimens, are being created to work on generally well-being and kidney capability in CKD patients. Ordinary active work assists control with blood pressure, works on cardiovascular well-being, and can slow the movement of CKD. By consolidating these way-of-life changes, patients can play a functioning job in dealing with their condition and working on their personal satisfaction. Now that we've shrouded the advances in CKD, how about we separate the phases of the sickness? CKD is arranged into 5 phases in view of the glomerular filtration rate, GFR, which estimates how well the kidneys are sifting blood. Stage 1. Kidney damage with normal GFR, GFR greater than or equal to 90 milliliters per minute. At this stage, there is proof of kidney harm, like proteinuria or hematuria, yet the GFR is as yet typical or high. The executive centers around controlling pulse, overseeing glucose levels, and addressing basic circumstances to forestall further harm. Stage 2. Mild reduction in GFR, GFR 60 to 89 milliliters per minute. Stage 2 CKD includes a gentle decline in kidney capability, with proof of kidney harm. The administration techniques are like Stage 1, however with expanded observing and preventive measures to slow movement. Stage 3. Moderate reduction in GFR, GFR 30 to 59 milliliters per minute. Stage 3 CKD is divided into 2 sub-stages. Stage 3A, GFR 45 to 59 milliliters per minute. Stage 3B GFR 30 to 44 milliliters per minute. At this stage, there is a moderate decrease in kidney capability. The executives incorporates more concentrated control of chance elements, conceivable reference to a nephrologist, and dietary acclimations to oversee side effects and forestall confusions. Stage 4. Severe reduction in GFR, GFR 15 to 29 milliliters per minute. Stage 4 CKD includes an extreme decrease in kidney capability. The executive centers around planning for renal substitution treatment, like dialysis or kidney transplantation, alongside escalated checking and the board of difficulties. Stage 5. Kidney failure, GFR, less than 15 milliliters per minute. Stage 5 CKD, otherwise called end-stage renal sickness, ESRD, happens when the kidneys can never again keep up with typical capability. At this stage, dialysis or kidney transplantation is expected to support life. Understanding the phases of CKD helps in fitting treatment and mediations to slow movement and improve patient results. Early location and fitting administration at each stage can have a tremendous effect in the personal satisfaction for CKD patients. To summarize, progresses in early identification, pharmacological therapies, regenerative medication, innovation, and way-of-life mediations are essentially working on the administration of persistent kidney illness. By figuring out the phases of CKD and remaining informed about the most recent headways, patients and guardians can find proactive ways to actually deal with the condition. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. Don't forget to subscribe to our channel for more videos on health and wellness. If you have any questions or topics you'd like us to cover, leave a comment below. Stay healthy and take care.